Do you consume a lot of salt? Can't resist salty foods like French fries, salami, and processed foods? Do you have high blood pressure? Or do you spend most of your time sitting without exercising? And do you think blood pressure medication should solve the problem of high blood pressure on its own? Think again. In this video, I'll talk about the 5 serious and recurring mistakes that a person with high blood pressure cannot afford to make. If you or any member of your family is experiencing any of these situations, it's important to correct them as soon as possible, as they can lead to a series of complications that will affect your health. High blood pressure is the leading risk factor for death worldwide. More than smoking, more than having diabetes, obesity, or high cholesterol. High blood pressure is like a time bomb inside us. If we're not careful, it can explode and cause serious damage to our body, such as heart problems, strokes, kidney diseases, and even eye damage. It's serious. But mistake number 1 is the most common one, so keep watching until the end to find out. But first, enjoy the video, because the more people like the video, the more YouTube will distribute it to people who don't have access to doctors or hospitals. There are many people suffering from high blood pressure in the world. By sharing the video with your friends and family, you'll be helping. The blood pressure you measure on your device at home or at the health center is related to the pressure your bloodstream is exposed to. Think about it, when blood pressure is too high, our internal organs are affected. For example, the heart needs to exert more effort to pump blood, which can lead to serious heart diseases like heart attacks, angina, and heart failure. The brain doesn't escape this either. Uncontrolled high blood pressure increases the risk of strokes, the leading cause of stroke, whether ischemic or hemorrhagic, and leads to death. It's a real danger. High blood pressure ages blood vessels. It strengthens, increases deaths from heart and vascular problems. But do you know what the main problem with high blood pressure is? It's just silent. It doesn't bleed from your nose, it doesn't give you headaches, it doesn't cause chest pain or shortness of breath. So there are many people who don't know they have high blood pressure. According to the consensus on high blood pressure, all individuals aged 18 or older should have their blood pressure checked at least once a year in the doctor's office and be aware of their blood pressure. So what are the 5 serious mistakes that high blood pressure patients cannot afford to make? Mistake number 5, not measuring blood pressure or measuring blood pressure incorrectly. Checking blood pressure at home is an important part of treatment. Do you have a blood pressure monitor at home? Is it calibrated correctly? Does it have a quality seal? It's important to check your blood pressure at least once every 2 weeks or check twice a week at different times. Why? The only way to know if your medications are working or not is to regularly check your blood pressure. This gives you the feeling that you're controlling your illness and that non-drug changes like exercise, diet, and sleep are working well. Your enthusiasm increases when you realize that your pressure used to be 14 and now it's always less than 11. Also, checking your pressure at the doctor's office is different from at home. Some people feel tense during the appointment and their pressure goes up, white coat hypertension, or vice versa. When they go to the doctor they relax and the pressure returns to normal. But at home it stays high, and that's what we call masked hypertension. By regularly checking at home, you're helping your doctor better track your treatment. How to measure blood pressure correctly at home? First, before 30 minutes of measurement, you shouldn't have smoked, consumed coffee or caffeine, and shouldn't have exercised. Your bladder shouldn't be full either, and 5 minutes before you start, you should remain seated. During the measurement, the cuff should be the right size. If you're overweight, the cuff should be the right size. Stretch your legs, sit properly, and let your arm rest on a flat surface, like a table, at heart level. After the measurement, you can measure again, just to confirm the accuracy of those measurements. It's important for you to check. Measuring twice a week is healthy and important, and now be careful with fake news. There are also many errors. Mobile apps don't work. The 4th serious mistake is the opposite. It reduces pressure all the time. Like everything in life, the extreme is not ideal. If you measure your pressure only when you go to your cardiologist once a year, it's too little. But measuring pressure all the time is exaggerated. I want you to make sure. I want you to have a working device at home certified from a good brand. Why not measure blood pressure all the time? There are people who check their pressure all the time and it ruins their quality of life. Why? Because the numbers you see on the screen generate anxiety. Don't check your blood pressure all the time. Stress causes constriction of blood vessels due to adrenaline and noradrenaline. What happens when you squeeze a hose in your house? More water flows. The pressure on the hose leads to an increase in pressure. So stress does this to your arteries. Check twice a week, or if you have a chart and your cardiologist says it's okay, you can do it once a week or once every 2 weeks. Not when you feel something, but when you're calm and relaxed. You shouldn't worry too much about a specific pressure, but how your blood pressure is overall. Focus on the forest and not on the tree. If your blood pressure overall is always good on the day you slept badly, filled yourself with coffee because of an important university exam the next day, ignore that pressure. I'll ask you a question. Have you ever done a stress test? Your blood pressure reached 180/90. Is that dangerous in the stress test? Probably not. That's normal. Your body needs to pump more blood to wash the muscles of the legs when you're running on the treadmill. So the message of this mistake is don't generate more worries and don't harm your health. Let's move on to the next mistake, adjusting medication on your own. You measure the pressure, it's high, and you double the dose of the medication on your own. Doubling the dose won't help. It will increase the side effects of the medication, double the cost, and can have a harmful effect. What should be done is to go back to the office to prescribe another medication. It would be more effective and wouldn't overload your body. And there are other cases where the person doesn't have high blood pressure, is stressed, decides to check the pressure, it's high, and decides to take his wife's medication. Make an appointment in 3 months saying this. And she doesn't know why it's not working. Because the medication that was given to the wife is one and to the husband is another. Treatment is individual and medicine is increasingly geared towards this fingerprint of personalized medicine. You shouldn't have a single prescription. Self-medication, changing the dose of the medication on your own without consulting a doctor, will make treatment difficult and can harm you. Instead of self-medication, the right thing to do is to calm down, rest, and check your blood pressure again after 15 to 30 minutes. Inform your doctor about this at your next appointment, or if your blood pressure is very high, 180/120, for example, go to the emergency room. Thinking that you don't need to change your other habits because you're taking the medication correctly, do non-drug treatment. Well, medicine is important, but do your part, do your duty. Reduce salt, or better yet, replace salt with light salt if you don't have problems with high potassium levels or chronic kidney disease. Why? Sodium retains fluids and potassium neutralizes the effect of sodium by releasing excess fluids. Light salt contains 50% potassium. And there are studies, one of the largest dietary intervention studies ever conducted in China and published in Circulation in 2021, that showed that light salt can reduce the risk of stroke, heart attacks, and dementia. Check it out, it's an easy and cheap intervention with an impact on your health. But of course, you need to adjust the rest of your diet. If you consume a lot of salt or sodium-rich foods like processed foods, yellow cheese, sausages, snacks, and sodas, including eliminating sodas. You need to consume more fruits and vegetables that help normalize pressure. Quit smoking, reduce or eliminate alcohol, lose weight if you're overweight or obese, exercise regularly, sleep well, reduce stress. All of this together will make your blood pressure better, and who knows, your doctor may be able to reduce or stop the medication over time. And mistake number 1, stop taking medication because the pressure was excellent. If your blood pressure is low all the time and you're experiencing symptoms like hypotension, dizziness, talk to your doctor. It's not up to you to decide. But the bigger problem is not this. The person is taking 2 or 3 medications to lower blood pressure and their blood pressure is well controlled 120/80, and they decide to stop everything. This will be a problem. For example, earlier today I measured my pressure and it was 110/70 and I didn't take the medication, otherwise the pressure would drop too much. Well, the measurement I did earlier today, yesterday's medication was still taking effect. The new blood pressure medications have a long half-life and take a long time to leave the body. You shouldn't measure your pressure to assess whether you should take the medication or not. You should take it every day. I'll talk about a concept you may not have heard before. The newest medications are blood pressure reducers, not blood pressure lowerers. That is, the medication will not reduce blood pressure, but it will tend to normalize your pressure. The drop in pressure adjusts to the level of increase in blood pressure. There is an interesting study where they gave the same dose of 3 blood pressure-reducing medications together for 4 months. What happened? The pressure stabilized over time. In the first month it was higher than in the 4th month for all categories. Patients with mild hypertension did not develop hypertension as the pressure was adjusted. Similarly, moderate hypertension did not become low either, the pressure normalized, and severe hypertension that was there improved in pressure and entered acceptable standards. This means that the newest medications are against hypertension and not for lowering blood pressure. So if your blood pressure is normal that day, take the medication as prescribed. Good blood pressure control significantly reduces the risk of stroke, heart attack, heart failure, kidney failure, and death. Take good care of your blood pressure. Do your best to avoid these 5 mistakes because everything will be fine and it will correct the problem. Did you like the video?